We're going to work on the Obex first. The most important thing is going to be to split this dura, to take it away from the stem. So we're going to take a pair of scissors and we'll just split straight down the middle of it. So now we have the largest possible opening to actually pull the stem. Second step we're going to do is actually come in and sever the cranial nerves that suspend the stem in the middle. This can be done by turning the scissors sideways on either side with the points pointed out. And to make sure that that step is done, we want to come back and check with just the blunt-ended scissors to make sure those nerves are gone. If the nerves are not severed, the stem will never come out. From this point, I'm going to use a spoon and I'm going to go in to sever the connection inside the head. The spoon is going to follow the track of the skull cap. So we're going to push the spoon in about halfway. At this point, you're below the Obex, so you can make any movement to sever the connection and not hurt our actual sample. So I'm going to move it back and forth here, and I'm going to pull the spoon out the same way. Now I'm going to take the spoon and I'm going to go on the bottom side and do the exact same motion to make the sever in this bottom. Just remember to stay below the Obex area so we don't tear up any of the sample we're trying to get. And then with the spoon, just use gradual pressure on the forceps, but with the spoon, let it pull to pull this Obex sample out. If you get hung with this sample, you may have to take the spoon and come in on the side just to sever that loose, then come back out, come back in, and continue to pull the sample up. But let the spoon do the work for you. And as you can see, this is a sample of the Obex we're trying to obtain right here. So once we finish the Obex sample, we're going to move to the retro lymph nodes. The easiest way to do these lymph nodes is to use a pair of curved scissors. Take the scissors and insert them right here at the top of the hyoid bone, and then just with a little bit of pressure pull straight down towards you. And most of the time, this node is going to come right to the top of the skin. With your scissors, trim around to trim all the fatty tissue off the node. And that's what we're looking for on the lymph node. Same thing, the lymph node is going to be sitting on this side. Do not use this node. This is the wrong one. So we're going to pull it out. And this one actually sits in this crypt right here. Once again, we're going to take and trim this node up. And take out our second lymph node.